Hi, my name's Destiny and I'm a student nurse. Are you okay if I do a head-to-toe assessment on you today?
Yes.
Okay, I'm just going to ask you a few questions. Just so I make sure I have the right person, what's your last name and your date of birth?
Elfman 04.1 1999.
Okay. Do you know where you are?
Yep, in Devil's Lake.
Okay, and do you know what date it is?
It is Tuesday, just kidding, Monday the 2nd of
Okay.
May.
Do you know what time it is?
Currently 9:30 at night.
Alright, and do you know what month it is?
It is May.
Okay. Are you having any pain right now? I saw that you were here for a broken foot on your right side.
No, I'm not really having too much pain.
Okay. Are you okay if I just take your pulse?
Yep.
Okay, your pulse is 82, so that's good. If I had a blood pressure cuff, I would check your blood pressure on your arm here just to make sure you didn't have any lesions or anything that would be affecting that side. So I'm just gonna go ahead. I would also take your temperature if I had a thermometer. Your pulse was good, and then your respirations were 21. So now, if you're okay with it, I'm just going to listen to your heart and lungs. Okay. Can I have you take a deep breath, please? Good. Your heart rate is about 75 beats per minute. I'm just going to listen to your lungs. I'll have you take another deep breath, please. Good. Would I be able to have you turn to the side here? I'll have you take a deep breath. I'll have you take another deep breath. And another deep breath. And one more deep breath. All right. Your lungs sound good. There is a little bit of wheezing, but otherwise they sound good. I'll just have you turn back this way, please. And now I'm just going to look at your pupils. So just have you take off your glasses. Can I have you open your eyes a little bit? Perfect. And then I'll just have you follow my light, okay? Good. All right. Then I'm just gonna measure your. Just look here. I'll just have you look straight at me. Good. Your pupils are about 3 millimeters on that side, and on this side, they're also about 3. All right. So, okay, I'm just gonna look. Your IV site looks very well. Do you have any issues with skin, any lesions, any wounds, or anything like that? Okay. Well, right now I'm just gonna check your capillary refill, which is good. It's less than 3 seconds, so that's very well. You do have a little bit of moisture on the skin, but otherwise I don't see anything that would be too concerning. How's your appetite then? Good. Okay. How about voiding or having bowel movements?
That'd be good.
Good. Okay. About how often do you go every day?
About once a day.
Okay. About how much water do you drink per day?
About 64 ounces.
Okay. Do you have any numbness or tingling?
No.
And you said you didn't have any pain, right?
Just a little bit, my right foot, but not too much.
Okay. Would you like me to see if I could get you some type of pain medicine for that?
Sure.
Okay. And on a scale from 0 to 10, what would you say your pain is?
About 2.
Okay. So if I had a pulse ox, I would take your oxygen level, and I would just do that by doing that on your fingers. Could I just have you lay down? I'm gonna just check your abdomen and check for. I'm gonna look at your feet and look for any. Is that painful?
Mm-hmm.
Okay, and I'm just gonna check your pedal pulse. Perfect. And you don't have any edema starting, so that's great. Your legs are moisturized. I'm just gonna listen to your abdomen, okay? They all sound very good. Now I'm just gonna push on your abdomen and tell me if you have any pain. Do you have any pain?
No.
Okay. Now I'm just gonna. Good. That seems good. I'll just have you sit up. You look pretty healthy. What kind of things do you like to do with your family?
Play cards.
Okay. Do you have any other concerns or anything? Do you have any wound vacs or And you don't have a catheter.
No.
How about any chest issues?
Nope.
Any breathing issues?
Nope.
All right. Well, I will let you go. And here's your call light. Is there anything else I could get for you?
Nope, should be good.
Okay, well, thank you, and thank you for letting me do your physical assessment today.
Thank you.
Okay, and now I will do my SBAR report. So patient is a 23-year-old male who is here at the transitional care unit with a right broken foot. Patient is going to be having surgery to repair the foot on May 1st. The patient does not have any significant medical history. Patient does not have any allergies. The patient is a full code. After surgery, the patient will remain in the hospital for 2 days and return to our care for therapy and then be able to go home by himself. On assessment, patient vitals were 122/62, pulse rate was 84, respirations were 22, heart rate was 75, oxygen level was 96%, and the patient stated that he was having no pain at the time. Later on during assessment, patient stated that he was having pain of 2 in his foot. He did not want any pain medication. The patient is alert and orientated ×4. He has been eating well, has been urinating and having bowel movements frequently. Patient is scheduled to have labs 2 days prior to surgery, and those labs will be fasting at this time. I have no concerns for this patient. Patient does not show any symptoms of distress, any skin lesions, and looks to be healthy. Recommendations: patient should complete labs 2 days prior to surgery fasting and complete surgery and return to the transitional care unit for therapy and then return home happy and healthy.